Hello and welcome to our Aging Life Care Moment with former ALCA CEO Kaaren Boothroyd. Kaaren, tell us how you got started with the association.
Sure. Courtney, it was in 2006, and I was in California, in Northern California, working at another nonprofit. And we had kind of toyed with the idea of coming to Tucson or to Arizona, and Tucson in particular. And I said, well, why don't I just check out and see what's going on down there employment-wise? And I found this position with what was then the National Association of Professional Geriatric Care Managers. And it looked like it really fit my experience and my interests to be a nonprofit. I had worked at a hospice in Northern California as an interim executive director and the director of marketing communications. So this seemed like a really good fit. So I interviewed, came down here, and the rest is history. So that started I was here from 2006 to 2016.
Well, that's great. Over the 10 years, I'm sure you've seen some significant changes. Tell us a little bit about some of the major changes that the association went through, the naming, the branding, other changes.
Yeah, well, when I came in 2006, the membership had just approved the requirement that to be at the advanced professional level, you needed to have one of 4 certifications. That was brand new. That was huge to introduce, but it elevated the profession. It brought more recognition to the profession. It was all the right reasons, but it meant that we needed to provide a lot of education and help in marketing and all the things that an entrepreneur, a geriatric care manager, or now aging life care professional needs. So that was huge. And then and we also, during that time, of course, all the technology boom was really influential. So our website got ramped up, highly improved. We started doing webinars, ebooks, all the things that we do. I mean, when I started, we had sort of a simple website and a listserv. That was the extent of our technology. So we've come a long way. So then in 2011, another big step is that we became self-managed, standalone. We had been managed by an association management company for the whole history, aside from the very beginning. So we became standalone. So that meant it was like building a business from the ground up, from furniture to computers to phones to everything. And it gave us a whole lot of more latitude, a lot more room for innovation. It took us to a whole nother level. So that was really exciting. And then in 2014, we started to explore the idea of the rebranding. And this was primarily because at around that time, the term care manager was just being used by everybody. There were care managers in assisted living facilities. There were care managers in retail operations. It was a meaningless term by itself. And we didn't own it. Nobody owned it. And we couldn't own it because we did discuss this, how we can make this our own, and we realized we couldn't. And so we started on the rebranding project, which was super, super exciting, super, super intense. And but it meant that we were out there with our members, with the public, learning about what people needed, what they had, what they didn't have, and how we were perceived, and what we needed to do to make a real impact, a real imprint on the minds of consumers, as well as other professionals, as to what care managers did or aging life care professionals did. So that was the last big project that I was involved with. It was a great experience.
Well, the association has definitely gone through some big changes, as you've just described. Looking at 2020, where we're in still in the middle of a pandemic, what are your thoughts on where we are now, and what do you see for the future of the association and the aging life care industry?
Yeah, I think now I'm on the outside. I mean, for 2 years, or no, 3 years, I've been outside the industry intimately. But I'm a baby boomer, and we've been hearing that the baby boomers aging is going to be huge on the healthcare and related industries. And it's all coming true. So all these baby boomers in their 50s, 60s, and 70s, they're all needing help. They're a very demanding group of people, as you probably know. And so I think healthcare and human services have had to rise to the occasion. I don't think they've risen to the occasion adequately, but there's no doubt about it that the need continues to grow. And now with the pandemic, it's even more heartbreaking because of the isolation. So this just adds another layer of concerns. I mean, ALCA, the nice thing about aging life care professionals is they do cover, the knowledge base is so broad that they do address so many facets of the aging process and needs. But with the pandemic, it's heightened it. So I think, for the foreseeable future, the needs are only going to increase, and until healthcare, until the pandemic is over, healthcare, we get some real reform, additional reform. I think it's going to be tough, but I think that's one of the benefits of aging life care professionals, or the association, and its place in the world is super important. And so I think the future is good if we can just get through this period. I think the future is really good for aging life care professionals.
Well, Kaaren, thank you so much for your time and telling us a little bit about the association's history and some thoughts on the future of where we can be going looking forward. So thank you again for your time.
Well, thanks. Good luck to you, to us all.